In St. Luke's, we're a group of doctors that we have special training for refractive surgery.
St. Luke's Eye Institute, in terms of expertise, we're very complete. A lot of our doctors are specialized in different eye diseases.
We tailor our screening to each patient to see which is best for them and safest for them. No?
In terms of ancillary tests, probably one of the most comprehensive eye centers there is. And of course, we offer all types of treatment modalities. Basically, one-stop shop for everything in terms of eye problems.
Good day everyone, I'm Dr. Jing and welcome back to MD in Focus, the show where we bring you valuable health tips and recommendations straight from our St. Luke's experts. Good day everyone, I'm Dr. Jing and welcome to MD in Focus, the show where we bring you valuable health tips and recommendations straight from our experts. As part of our Sight Saving Month celebration here at St. Luke's Medical Center, we are raising awareness on the importance of protecting your vision through early detection, expert care, and accessible treatment options. Today, we're so lucky to be joined by two of our top specialists in the field of ophthalmology, Dr. Vicencio, head of the St. Luke's Eye Institute, and Dr. Irwin Cua, head of the Vision Laser Center. Good day, doctors. Thank you so much for joining us today, and I'm sure you will all learn so much from our doctors this morning. Doctors, what are the most common causes of vision loss in the Philippines?
Well, cataracts still account by population to be the #1 cause of serious vision loss. Next would be diseases like glaucoma, diabetic retinopathy. There's a new trend in age-related macular degeneration as well.
I see. So cataracts,
Yes, glaucoma,
and that age-related
macular degeneration.
What about in younger people, Doc? Have you been seeing more visual issues with the younger generation these past few years, I guess?
For younger patients, we're seeing more of we see digital eye strain. That's increased computer use. That's also associated with dry eyes. So we see a lot of even young patients, they come in, they have dry eyes, they have headaches. So these are usually commonly associated with prolonged computer use. Yeah.
Who is most at risk for serious eye diseases, and how could we inform them in terms of protecting themselves?
Well, older patients, the ones from the elderly senior citizen population, they're actually more reluctant to come for a checkup. Probably it's the lack of awareness or the fear of finding out something like a serious eye illness. The most important thing is to still come in early, have these diseases detected. So if they're caught early, we can actually do a good amount of prevention and an early treatment intervention.
Doctors, could you tell us more about refractive surgery and what kind of patients do you usually see for these types of procedures?
For laser refractive surgery, we have three main types. No? So we have our PRK, bladeless LASIK, and then SMILE. No? So all three are good procedures, but we tailor our screening to each patient to see which is best for them and safest for them. No? So the SMILE is a newer technology and it has certain advantages over, let's say, LASIK.
What does SMILE stand for?
SMILE stands for small incision lenticule extraction. So it has a different way of doing laser refractive surgery. So firstly, it has less dry eyes, causes less dry eyes, and then it doesn't have a flap. So it's ideal for people who have an active lifestyle or into contact sports. Usually after SMILE, they don't even have to wear like protective goggles. Unlike LASIK, we advise them to wear protective goggles for about a week.
Because LASIK would have a flap.
Yeah, so we want to make sure that during the healing period, the flap won't move.
Okay, so who are those who would benefit more from the LASIK naman?
The ideal age group maybe around 18 up, so 18 years old, just to make sure that their refraction is stable. Usually that age 18 to 21, we just want to make sure that their grade is not changing anymore. So probably around up to maybe 40 or 50, no? But now we have a newer procedure also. It's a It's like to address presbyopia, which is for reading. So we have a way to help patients reduce their need for reading glasses. So that's for 40 up.
Okay, so yung presbyopia is more of
Difficulty reading associated with age.
with aging.
Yeah.
So a lot of us are aging, and I'm sure a lot of our viewers have presbyopia already. So I
Yeah.
didn't know that we have
There's a
procedures
way,
already.
yeah, it's not for everybody, so we screen them very well. For PRK, it's an older procedure, but it's safer in certain cases. Like if your corneas are thin, but the main disadvantage is the healing period is a bit longer.
To add to the laser refractive procedures, for extreme refractive errors like grades very high, like 900, 1000, or even higher, even coupled with astigmatism, we can also offer what we call phakic intraocular lens implants. So it means that we put a lens on top of the natural crystalline lens of the patient. It will replace having to wear contact lenses or very, very thick glasses.
How important, doctors, would early detection be, and yung prevention of progression of vision loss, especially among our younger population and those who have matured already and are going well into their prime ages, such as us?
Early detection is important because there are a lot of eye diseases that have insidious onset, meaning the symptoms are very mild or minimal. For example, in glaucoma, patients don't really notice any visual disturbance, even if their visual field is slowly becoming smaller. Yeah, the most common ones would be eye redness, headaches, maybe a little bit of eye pain. And if you have a family history of this, try to come in early and have your screening tests done, because a lot of patients do come in the late stages, and these changes are already permanent or irreversible. Then it will be harder to treat them. But if they're detected early, you won't really have the advanced stage of the disease.
So why do you think people should go to St. Luke's when it comes to protecting their vision?
Well, the St. Luke's Eye Institute, probably in terms of expertise, we're very complete. A lot of our doctors are specialized in different eye diseases. In terms of ancillary tests, we're probably one of the most comprehensive eye centers there is. And of course, we offer all types of treatment modalities. So it's basically one-stop shop for everything in terms of eye problems.
In St. Luke's, well, probably I think the main advantage is that we are a group of doctors that we have special training for refractive surgery. So there's a group of doctors that will manning the refractive center so that we discuss for difficult cases, we collaborate to see which option will be best. And the other main advantage is, I think, is that if my patient comes in for a screening, I will do the screening or I will check the screening for them. And then I will recommend which procedure is best for them, as well as do the surgery and also do their follow-up checkups. So I think that's one of the main advantages of St. Luke's is that the doctor will see you through the whole procedure.
So you don't have to go to somebody and then you schedule again.
And then, or somebody sees you and then somebody does the surgery and then someone else will do the follow-up. So I think that's one of the main advantages.
Thank you so much, Dr. Vicencio and Dr. Cua, for sharing your time and expertise with us today, with our audience. As we wrap up this Sight Saving Month episode, we hope this conversation reminds you to take care of your eye health seriously, whether it's getting that long overdue checkup or learning more about treatment options that can improve your vision and your quality of life. If you've been thinking about procedures like LASIK, PRK, or SMILE, now is a great time to take your next step. Thank you for joining us, and remember, caring for your eyes is one of the best things you can do for yourself and your family.